Hi, my name is Brittany Holler Barkley, and I'm a doctor of veterinary medicine at Springs Road Animal Hospital in Hickory, North Carolina. Today I'm going to talk about dog allergies and what we can do to help your pet if your dog is experiencing these things. Um, so, um, so dogs can have allergies that are similar to us or a little bit different. Dogs are more likely to have allergies that manifest in their skin or in as kind of recurrent lesions and skin infections, as well as sometimes GI infections and GI sensitivities. Occasionally, we will see issues where they have allergies, kind of like hay fever in humans, but that seems to be a little bit less common in dogs. However, we can do things and we have really great options to treat all of those allergies if your dog is suffering from one of those things. Um, so, um, kind of the most common thing that we see is probably the allergies that manifest themselves as skin issues. And that can be particularly annoying for owners because the pets get really itchy. And then because of that inflammation that occurs in the skin, then we see a disruption of the skin barrier. So then they get secondary bacterial and yeast infections sometimes. And kind of the infections, if they go on for a long time and they're not treated, sometimes they can develop into resistant infections. So sometimes we'll need to send off cultures to determine exactly what's growing and what the best way is to treat that. Um, at the same time, if we are treating your dog for skin allergies, we will not only want to treat that infection, but we will also want to treat the cause of the itchiness and the inflammation. So, kind of the most common things that we'll use for that. So, we used to pretty much only have prednisone. And steroids as an option. That is still an option, but we try to use that more in the short term if really needed, and less kind of long term because long term steroids can have a lot of side effects. We also have a class of drugs now that's called JAK kinase inhibitors. So these are things like Apoquel. Um, and then we have Cytopoint, which is a immunomodulatory drug as well, and that decreases the cytokines that are involved in the itch and inflammation in your dog. So those are some of our options. Um, some dogs will have allergies to fleas, to food, or the environment, and those environmental allergies can have a seasonal component to them. So sometimes we will have some pets that we need to treat kind of during a certain season, like during the fall months or the summer months. And if we can kind of figure it out the pattern, then we can get ahead of it sometimes by starting those medications a little bit before they typically will have an issue. Um, some dogs will have ear infections that will be a manifestation of their allergies, and sometimes we can see those being caused by food. Typically, it's more food or environmental. If your pet seems to have ear infections or recurrent skin infections year round, then it's probably not just the environment. Although maybe if you live in someplace like North Carolina, it may be more food or fleas. So if we have a pet that we're concerned about allergies, we're going to recommend that your dog be treated with a flea preventative year round just to kind of take care of that component of it. And then we may discuss a food or a diet trial. And usually that's an elimination trial with a very strict diet, a prescription diet that is either going to be hydrolyzed or a novel protein. And we'll usually recommend that for up to 8 to 12 weeks, kind of depending on what the symptoms are that we're seeing in your pet. And those can definitely be helpful. And unfortunately, we do have allergy testing, but the only way to determine if your pet has food allergies is to put them on a dietary trial for that period of time and see if they have an allergy flare. As far as long-term solutions for pets that have allergies, we do have the ability to send off blood work to test, and that is more helpful when we are concerned about environmental allergies, because that can kind of test for the different molecular markers in the blood to all of the different things that we would typically see. And we can either do that in this area or we can kind of do environment in general in the country. depending on if your pet is kind of just stays locally or if your family travels a lot. And then the other things that we can consider are coming up with a specific plan for your pet. So if you do have additional questions, please feel free to give our office a call. Springs Road Animal Hospital in Hickory, North Carolina. Our phone number is 828-256-2151. And we would be happy to set up an appointment to discuss your specific pet's concerns, your specific dog's concerns, and in general. And thank you so much.